In a basic emergency kit, you have an oxygen tank, and usually it's an E-tank. If you look at the dial on it, it will say that it's empty. So it's not empty, probably. What you need to do, there should be a regulator on it. You turn it counterclockwise, you should hear like a hissing. It should go up to the green and show that it's full. Then what you would do is you turn it clockwise to shut it off, and you know that your oxygen is full. That has to be done on a regular basis to make sure there's no leaks or anything. You know, in our situation, oxygen, it's not going to be a life-saving tool. There's no situation that we have that oxygen is going to save the person's life. And if that's our goal, it's not going to be your first grab. What I like to do for oxygen, I always like to attach the ambu bag to the oxygen tank because I feel like that's the only time you're really ever going to use it. But if you need the ambu bag, you can use that without oxygen too. It doesn't matter, you don't need the oxygen. So that is something that is emergency, but just know that oxygen has kind of been a little bit put on the back burner for us. Oxygen is very important, but for us, it's not gonna be our first line of defense. The AED is super important. If someone's having some kind of heart conduction issue, the AED will check it and will regulate you. The AED only works if the battery is charged and if the pads are current. So I cannot tell you, especially after COVID, how many offices I've gone in and checked out emergency kits and everything's really old. So really make sure, check your AED. You have to, in most cases, have an adult and a child pad because you don't know who's having the emergency. It could be the kid that comes in with their parent. So you have to have supplies for multiple ages, even if you don't treat kids or you don't treat adults. All right, so there's two things, nitroglycerin and albuterol, sort of do the same thing for different systems of the body. So nitroglycerin opens up blood vessels. So if someone has constricted vessels, either due to buildup in the vessels or some sort of blockage, nitroglycerin would open up a vessel. Albuterol does the same things for where you breathe. So if the breathing tubes are all kind of tight and constricted, albuterol opens that up. So they're kind of similar, working on different systems. The albuterol that is in your kit has probably been sitting there and isn't used. So it needs to be primed, which means that it needs to just kind of equilibrate so that it's the right concentration because it's probably not mixed evenly. So what you would do is you would do about like 4 pumps in the air. Albuterol, I am an anxious person, so I'm letting you know that albuterol is okay if you breathe it in accidentally. So if I squirt some pumps of albuterol out here, nothing's gonna happen to me or anybody else around. So that's okay to do. So you'd squirt a few pumps, you'd shake it up, and then you'd follow the instructions for albuterol to give the person that. But ideally you want the person to bring their own. There's a couple of contraindications to nitroglycerin. One would be low blood pressure because nitroglycerin lowers your blood pressure, so you don't want to make it less. Another contraindication would be if the person is taking erectile dysfunction drugs, you do not want to give them any nitroglycerin because that is deadly for them. So you need to know your patient's medical history. Most likely, if the patient needs it, they have that with them. So nitroglycerin, albuterol, and EpiPens for someone who has an allergic reaction, you kind of want those people to bring their stuff with them. Also a diabetic patient, you would obviously want them to bring their insulin and their blood testing stuff with them. Aspirin prevents clots from forming, right? So it dissolves clots. So you would take aspirin if there's chest pain and there's no contraindication to it. The thing about aspirin is you want something that acts fast. So chewing aspirin is faster. So you would give your patient that has chest pain, ideally you want to give them 2 to 4 baby aspirin or low dose aspirin because they're chewable. If not, if all you have are the regular 325 milligram aspirins, you can give them that, but they have to chew it. So it's a little bit gross to chew that. So that's why it's always good to just get some, generic low dose 81 milligram aspirin on site. Epinephrine, you should have 2 of them in your office. You should have an adult one and a child one. Most governing bodies want you also to have epinephrine vials in your office, extra ones, and some small syringes. Just note that, I see that vial and I see, oh, there's a dose, but that's not a dose. The doses are so small that you have to only pull up a little bit of that into the syringe. So that's why you have the EpiPens, the preloaded syringes. Diphenhydramine, as I said, is Benadryl. That would be if you give someone, it's maybe having like a little allergic reaction, but it's not really progressing to anaphylaxis. You can give them that. And then sugar. If someone is hypoglycemic, if they do not have enough sugar, you want to give them, ideally the tablets are better. They come in tubes and you just chew a few of them. And you're only giving this to conscious people. If your patient is having a situation and they are not conscious, you're not giving them anything. I don't care if it's frosting, juice, something that you think they don't have to chew, you are not giving them anything by mouth.